Neck rejuvenation secrets. Say goodbye to tech neck lines, crepey neck skin, and turkey neck. Ooh, AJ's in here. I try to do these videos in between patients, but AJ's gonna keep me on time. Okay, next one. Is your neck skin giving away your age? Usually by the time changes in our neck skin happen, it's too late to do anything about it. Actually, it's not, because there's things that we can do in the office and at home that can reverse these changes and to help tighten and smooth neck skin so that the skin on your neck matches the quality of the skin on your face. From tech neck lines to sagging, crepey neck skin, there's lots of things that we can do to help rejuvenate this area. And a lot of it has to do with stimulating collagen and stimulating elastin synthesis, which are the extracellular matrix proteins in our skin that give skin that smooth, bouncy, firm, tight turgor. And at 47 years old, I'll give you some of my tips and tricks that I use on my own neck as far as procedures and at-home treatments that I do to keep my neck skin rejuvenated and matching the quality of the skin on my face. With Thanksgiving right around the corner, let's tackle the dreaded turkey neck and talk about science-based and science-backed solutions to help improve the quality of this skin so that the only turkey neck that you're having on Thanksgiving is on your dinner table. Hi, my beauties. My name is Dr. Stephanie Capel, and I'm a board-certified, fellowship-trained cosmetic dermatologist who's here to provide free educational content on YouTube that's non-sponsored so that you can experience healthy, beautiful skin at every age. And today's video is going to be focused on an area that's usually and most often neglected, the neck. We'll cover all the aging concerns of the neck, including crepey skin, laxed neck skin, photo damage, tech neck lines, platysmal bands, turkey neck, submental fullness, and all the things in between. I'll also discuss in-office procedures and at-home procedures that you can do to keep your skin on your neck looking smooth, tight, and firm throughout the decades. But first, I just ended clinic and I have to go pick up my son from surf practice and my daughter from volleyball practice, and I will see you guys at home. Okay, why the neck ages differently than other areas of our body and how it ages differently than the skin on our face. The dermis and the epidermis of the neck skin is different. It's thinner and it lacks a lot of the structural proteins that we have in our face. It also histologically, which in science just means under the microscope, lacks a lot of the glands and oil glands that we have in our face. So under the microscope in our face, when you look at the pilosebaceous unit, it's the little vellus hair follicles on our face that are accompanied by an oil gland and ductular-like structures. In the neck, we don't have as prominent number of glands, and the glandular structure of that neck skin is different. So it doesn't have that like support and structural support. It lacks a lot of the extracellular matrix proteins that we have in the reticular dermis that we have in our skin on our face. So although we do age in our skin on our face, the neck and décolleté skin is so much thinner and lacks so many of those extracellular matrix proteins, collagen, elastin, glycosaminoglycans, and all of the proteins and sugars in our skin that gives skin that nice, bouncy, firm turgor. We do lose that with time, but there's even less of that in the neck and décolleté. In addition, because of the difference of the sebaceous glands and the glandular components of our skin, it ages at a more accelerated rate than our face. Oftentimes, in addition to that, we're usually photoprotecting and using active ingredients and paying more attention to our skin on our face in our 20s, 30s, and maybe in our 40s. And then later on, we have this aha moment that we have to catch up our skin on our neck and our décolleté because it's showing our age. So having healthy habits to incorporate early preventative measures earlier on and preventing that accelerated photoaging of that skin is really, really important. However, if you've already had damage done to those areas and your skin on your face is not matching the skin on your neck and décolleté, there's definitely things that we can do at home and in the office to help rejuvenate that area so that it can catch up and kind of match more the skin on your face. Okay, next I want to talk about lifestyle habits that can cause accelerated aging and photo damage on the neck and décolleté. When we're walking around and we're protecting our skin from ultraviolet light that is either being bounced or reflected or absorbed by our sunscreen in our products that we use on our face, sometimes if we neglect to put photo protection or sunscreen on our neck and décolleté, you're not only getting the UV light or blue light from our devices or environmental toxins and pollutants from the environment and radiation, LED and HEV light, but you're getting it reflected and bounced off of the surfaces that we're walking on. So whether we're on the sand, on the beach, if we're on the asphalt or on a sidewalk, or in snow, if we're snowboarding or skiing, we're getting amplification of that ultraviolet light, HEV light, blue light, UVA1, UVA2, UVB rays that are being bounced and reflected off of surfaces too. It's more of an intense reflection and more of an intense trauma to the skin than it is even on the face. Another interesting component is why men don't get that kind of crepey, laxed skin on the neck. Now, men get a different type of aging phenomenon. They sometimes will get, laxity of the muscles, of the digastric muscles, or different muscles in the neck that can kind of lose elasticity and lose that tensile strength. So they sometimes will get the double chin, and they'll get kind of that connection between the chin and the chest, or the chin and the neck, and they get a fullness, which is called the double chin or extra adipose tissue, in the submental area. Submental is just this area, that's what we refer to it in medicine. But because they have terminal beard hair in the neck, they don't lose that structural support and those structural support proteins, and they have a lot more stem cells in their skin than women do, because we don't have terminal hairs. I mean, I know some women may have hair on their neck or hirsutism, depending on their genetic background and so forth. But for most intents and purposes, women don't have beard or terminal hair on their neck, which means we lack those structural support proteins. We lack those structural support hair follicles and pilosebaceous units and the stem cells that lie the infundibulum and the isthmus and the structures of the hair follicle. And men don't get that. They also don't get it around, they don't get lip lines. Have you ever wondered why men don't get lip lines? Because they have those terminal hair follicles in that periorbital skin, and they also have it in the neck. So that's a little bit unfair, but they get other things too, so it's fine. But just, it's really kind of goes to show you that the histological component of the neck skin will make sense when you see the changes that are happening over the decades as we gain wisdom and have birthdays. So increasing upregulation of extracellular matrix proteins in the neck, and treatments in the office that we can do to do that, and then at-home products that can upregulate expression of genes that can express these proteins and increase their density in the skin, can overall have potent rejuvenating effects. So continuing on lifestyle habits that can help keep that skin in that delicate neck and décolleté area healthy includes photoprotection, rain or shine, even day or night, I would say, because even if you're on your devices, if you see blue reflection in the mirror when you're on your laptop, on your iPad, on your phone even, if you're in the fluorescent lights at the gym, sometimes I work out at 5 in the morning when it's still dark outside, and I still wear sunscreen on my face, neck, and chest, back of the hands too. And it really is important over a lifetime, especially starting in your 20s. I'm 47 now, and I started wearing sunscreen on my neck and chest when I was 20 or 21 years old, because I knew I wanted to be a dermatologist, and I was obsessed with the skin basically at that early age. And so I started photoprotecting myself early. And also, Mom, if you're watching this, you were always a big advocate of sunscreen, and I thank you for that. Also, diet, exercise, hydration status, drinking at least 2 liters of water a day, you eating green leafy vegetables, and keeping up with your antioxidants that you're also eating, not only putting on your skin topically, but eating is really important too. Also, studies have shown positional lifestyle habits. So if you're looking at your phone, trying not to, create those tech neck lines, which can also be anatomical, but just, I remember I went through like a month of my life where I was trying to hold my phone up and not look down. Now, sometimes that's not sustainable for a lifetime, but just try to be mindful of your posture, even just sitting up straight and trying to keep your chin up. Not only is better for your back and your spine and your cervical spine, but it's better for your neck skin as well. So if you can kind of maintain your posture when you're sitting, at a computer, if you're at a cubicle all day, ergonomically making sure that your, chin isn't to your neck and your chest like this all day will help improve neck skin as well. Now, I know a lot of you guys are going to ask me about those stickers or those sleep stickers that you can wear to kind of preserve your neck. Just be careful with those, because the tensile forces and strength that happen when you peel those off can sometimes cause more harm than good. It can cause increased neovascularization or creation of telangiectasias, and in English what that means is just more broken capillaries and blood vessels, which can give the neck and the chest kind of that ruddy looking appearance. Just be careful with the type of stickers that you're using, because sometimes they can cause more harm than good. Common neck aging concerns. So first, tech neck lines. What are tech neck lines? These are those horizontal bands that go across the neck, and they can be from looking down at your phone or your computer, which is why they're called tech neck lines, but they can sometimes just be anatomically present. I have kids or teenagers, you know, they're very young that start showing the creases in their neck, and it's not technically from tech neck lines, but could be just anatomical. I always say just, you know, that's a genetic predisposition and an anatomical variant, and I wouldn't go chasing that, especially at a very young age. But tech neck not only is just from, you know, positional, but it can also be genetically inherited too. Crepey skin on the neck can start in our 40s or even as early as our late 30s, depending on your genetic predisposition and how much photo damage you've had in your lifetime. But the reason why we get crepey skin is because you have a loss of collagen fibers and elastin fibers and extracellular matrix proteins in the dermis, the papillary and reticular dermis. And looking at skin under the microscope for decades, I could see this with each decade of life, how you lose more of those extracellular matrix proteins. And under the microscope, instead of being thick, chunky, healthy collagen bundles, there's these wispy, fragmented, dysfunctional collagen that correlates clinically with people having just laxed, thin paper, crepey toilet paper, wet toilet paper skin is sometimes what we would call it when we're suturing people up in surgery. So crepey skin is just a lack of extracellular matrix proteins that happens as we get older, but also gets degraded at an accelerated rate by environmental insults. So things that we can do in the office, like lasers, energy-based devices, biostimulatory injectables, and at home by using active ingredients that upregulate collagen and elastin synthesis, can help offset that, and also can be a prejuvenating treatment that you can do to increase your collagen and elastin stores. So that as we lose 10% of collagen each decade, you're kind of staying ahead of the game and you're increasing your reserves so you can really stay in one place and reverse aging. And that's the true meaning of anti-aging and prejuvenation. So laxity. Laxity is kind of in the same category as crepey skin and also happens from a loss of extracellular matrix proteins, but can also happen if there's a dramatic weight loss. So with weight fluctuations, also with like swelling or change in volume status, it can increase laxity. So even like, you know, if you've had babies like me, sometimes laxity on the abdominal skin can happen from all that increased growth and then volume depletion. So a lot of patients who are on semaglutide medications or, you know, Ozempic equivalent medications and have a rapid weight loss are seeing accelerated crepiness in the neck because of that volume status change. And sometimes when the weight loss is faster than your body can, you know, keep up with adjusting the collagen density or elastin density in the skin, there's an accelerated aging process that can happen, and that also can present with crepiness and neck skin laxity because of that decreased volume without the skin having time to catch up with increasing collagen synthesis to kind of tighten up, you know, the lax skin that is a result of that volume depletion. So tone or hyperpigmentation irregularities, things like melasma, chloasma, even post-inflammatory hyperpigmentation, or poikiloderma of Savant. Dermatologists love to have long, complex names for pretty simple phenomena in the skin. Poikiloderma of Savant, C-I-V-A-T-T-E, is a phenomenon that happens when you have this almost like dirty appearing neck, and it's a little bit of redness, it's a little bit of dark, you know, brown hyperpigmented spots with hypo light pigmented spots, and so you have this like dark spots, light spots, red spots, and this kind of this like mottled looking, it's like a weather beaten appearance. And what happens is over years of chronic sun exposure, you have increased neovascularization or increased new blood vessels, which gives skin that kind of ruddy red appearance. And you have hyperpigmentation juxtaposed to hypo or deep pigmentation, where the melanocytes or the pigment producing cells stop producing melanin or pigment because of the photo damage, or they're upregulating their melanin synthesis to help photoprotect from the UV insult that the skin is exposed to. So it's just kind of this hot mess that happens in the neck, happens in the chest too, décolleté, and usually there's a combination of lasers that can be used to treat it. Usually V-beam, or some get the red out laser in the red scope of lasers with respect to the wavelengths of 595, 532 nanometer wavelength lasers. I hear my brain getting too scientific, so I'm gonna try to take it down a notch. So there's V-beam, there are KTP, there's XLV, there's different lasers that will get the redness out or the red component out of the neck skin. But then you want to do something that's going to upregulate collagen synthesis, like a Fraxel or a CO2 or an erbium or a halo or a clear and brilliant. It can be fractionated or non-fractionated. It can be ablative or non-ablative. And if you're not sure about what I mean about that, refer to my other videos where I kind of get into the specifics with lasers and do a little laser lecture for you guys. But usually it's a combination of lasers, and anywhere between 1 to 3 treatments are needed for best response, but this can offset that photo damage and pigmentation alteration that can kind of give that neck that kind of ruddy, aged appearance. So sometimes just increasing and evenly distributing the melanin distribution and evenness in the skin can make our necks look younger. I actually struggle with melasma, and I do get melasma on the sides of my necks. My son's a competitive surfer, and sometimes I have to spend like 10 hours on the beach watching him surf, and no matter how much sunscreen, I'm under my umbrella, I look like a crazy person because I'm a surf mom / dermatologist, and no matter how much I photo protect, sometimes my melasma will creep in on the neck, and that can age the neck. And so I'll just do a little Pico Toning Clear and Brilliant 1927 nanometer Fraxel, and then I'll do some hydroquinone or vitamin CFK by Ellure, and I'll get rid of that brown pigmentation, and then the neck looks rejuvenated. So just altering the pigment and correcting pigmentation can just make the neck look younger, more supple, and rejuvenated. Finally, turkey neck, and with Thanksgiving being next week, it's appropriate to talk about what is turkey neck. Turkey neck is just a neck that resembles kind of a turkey waddle. And what does that even mean? It's just that kind of laxed, crepey, involuted, textural irregularities containing skin on the neck, which is just a component of multifactorial insults that can happen to that delicate neck skin. So usually a resurfacing laser, using topical argireline containing products, or products in your skincare actives that's going to upregulate collagen and elastin synthesis, and active ingredients that's going to even out the hyperpigmentation will make the neck look better so that you don't walk around having a turkey neck. So at-home skincare for neck rejuvenation. So it's really important first and foremost to photo protect, and getting a good mineral or physical blocking SPF is usually my recommendation for my patients. You want to block not only UVA1, UVA2, UVB, but also you want iron oxides in your sunscreen like Color Science or Elta MV or Elta MD, or other sunscreens that have iron oxides that are going to also protect against environmental toxins and pollutants, again, that are going to help decrease the incidence of free radicals and the breakdown of collagen. So photo protection for sure, I would put almost as my number one. Also barrier restoring, hydrating moisturizers, and ceramide containing moisturizers will help keep the neck skin smooth and supple. It will allow the skin cells to hold on to water, minimizing transepidermal water loss and keeping water within the skin, which can make this neck skin look more hydrated, soft, and supple. Also, active ingredients containing components that are going to upregulate collagen synthesis. Now, be very careful with using tretinoin or vitamin A derivatives, including retinol, on the neck. I say just use it once a week. You can refer to my other videos. I did a tretinoin video and a retinol video. You want to be very, very careful, because although your skin may be able to take an increased frequent use of these actives, remember the neck skin and décolleté skin are different, and they can't withstand some of the irritation that you may be accustomed to tolerating on your skin, on your face. So I always say just go low and start slow. Use a retinol once a week on your neck. If you wanted to use my line, MDR, it's one of the smartest retinols in a vehicle delivery system that's microencapsulated to pack a punch with efficacy, but without all that sensitization, because of the way it's engineered and formulated, keeping the active ingredient inside the cell and not in the extracellular matrix or milieu, which is going to help decrease the sensitization of that product. But using products that are going to upregulate collagen synthesis, also that are going to help even the melanin and even the tone of the skin, like a vitamin C. You want an L-ascorbic acid containing vitamin C, like the MDR vitamin CFK. You also want to have barrier restoration moisturizers. As I mentioned before, they're going to have increased ceramides and increased natural moisturization factors that are going to restore the barrier and keep water within the skin cells for a plump, supple, smooth neck skin. In addition, topical argireline is also another important active ingredient to look for. It's the same type of mechanism of action as Botox. It's like Botox in a bottle. It's like topical Botox. It affects the snap-snare complex, which is a scientific terminology, but in English what that means is it relaxes the smooth muscles that's underneath that delicate thin skin to kind of help relax those smooth muscles to get a tightening effect on the neck, because when the smooth muscles are kind of crunching up and crumbling up underneath, the skin is like an accordion. It kind of like crunches and crumbles on top of that. So when you use active ingredients to kind of relax those smooth muscles and the underlying thin muscle right underneath the skin, it just gives a really tightening and smoothing effect on the neck. So topical argireline, like the Neck Tight Serum by my line MDR, is also a great one to use as well. So in-office procedures that we can do in the office to help rejuvenate the neck and décolleté area. We already mentioned laser resurfacing. Now, lasers can be as minor or a mid-level or aggressive as you want, but on the neck you have to be careful as far as the settings, number of passes, and how aggressive you are with that skin, because that skin is thinner and more delicate than the skin on our face, which I've mentioned throughout this video. So you can have ablative or non-ablative lasers. Ablative would be more like a CO2 or an erbium. Proceed with caution with ablative lasers because they can come with more risk. They're a little bit more aggressive, and just be sure that you're seeing or getting treatment by an astute laser fellowship trained laser specialist as possible. And then you have non-ablative lasers like the Fraxel Dual, also known as Fraxel Restore. You can have a Halo, which is a combination of ablative and non-ablative. You can have a Clear and Brilliant, which is a non-ablative fractionated laser, which has great rejuvenating potential without the downtime and without a lot of discomfort as well. So lots of different lasers to address collagen stimulation to help the texture of the neck skin. Also, we mentioned V-beam or other redness lasers like XLV or KTP to help get that readiness out of the neck. And as far as melanin distribution and evening out the melanin, when the melanin or the pigment is all in one dermal plane, when you're looking at the skin on cross section under the microscope, it looks beautiful. It has that glow. When melanin's kind of like patchy and irregular in its distribution, that's when you have brown spots, you have sunspots, and it looks like ruddy and it looks weather beaten, and that's not what you want. So lasers like Pico Toning, the 1927 nanometer Clear and Brilliant, or the Fraxel will be great lasers for evening out the tone or the pigment of the skin on the neck as well. So energy-based devices for the neck, I'm just gonna be straight. Again, I'm not sponsored, so I can say whatever I want about any company and I can't get in trouble. I don't get paid by companies to talk about their devices, which is really, really beautiful for me to you guys, so I can just speak the truth. And if something new comes along that's better, I can always talk about that too, and I'm not tied by any company to say something about a device that I don't truly feel is the best for my patients. I really love Thermage. Thermage is a radio frequency-based, energy-based device that puts heat in the form of radio frequency into the skin. I'm not to stimulate collagen and to upregulate fibroblasts, which are the collagen-producing cells in the neck skin, to make increased collagen to help lift, tighten, and pull and smooth that neck skin. I've done it 4 times in my lifetime. I do it every 5 years. I started at age 30, and I did it at age 30, 35, 40, and 45, and I'm glad I did. It's kept me out of the OR so far. So far, so good. I'm gonna knock on wood. But I think other energy-based devices may not really compare. I've used them all, you guys. I've had them side by side in rooms. I've compared and contrasted the results with my patients. I'm not a huge soft wave fan. I'm not a huge L-therapy fan, just because I feel that with experience with these devices, the results are a little bit underwhelming and patient satisfaction rates aren't as high as they are with Thermage when Thermage is done correctly. And radio frequency with microneedling, I'm not a big fan of. I just had a patient today in my office who had severe volume depletion and thinning of her skin from radio frequency with microneedling. So I'm not a big fan of that. You'll see it very commonly on almost every med spa in town, but that doesn't mean that it's the best device. It's probably the least expensive as far as overhead, so that's why you'll see them a dime a dozen on every corner of every street in Corona Del Mar and Newport Beach where I practice. But I'm not a huge fan of them for the neck, especially given the risk that it can thin the neck skin and cause complications like hyperpigmentation and so forth. Okay, let's talk about neurotoxins or neuromodulators. Now this could be, there's so many now. It could be Daxxify, Botox, Dysport, Jeuveau, Xeomin. There's so many. So pick your toxin of choice, and I can do a whole different video on the differences between all the toxins, but it's important to know the different areas that you can inject in the neck. Now, as a provider, I never personally inject more than 20 units in the neck right here. And that is because you never want to overdo that area, because again, I do Pilates 5 days a week. I need my core strength. And I feel that sometimes, you know, you want to provide a little support behind your head so you're not straining your neck muscles. But when you do Botox, it can weaken those muscles to when you're doing core strength in Pilates or a certain workout, it can decrease mobility and strength in the neck. But if you stay under 20 units, and make sure you go to an astute provider, you guys, because this is it's a higher level of injection skill when injecting the neck, but I've been doing it 20 years without a problem, knock on wood again. But it can really help smooth out the neck. It can also be done along the tech neck lines, along the tech neck line itself, to help relax the tech neck lines with really great results. So the different areas that you can inject the neck include tech neck lines, which is along the neck lines. You can do the platysmal band. When people do this is a platysma right here. You can inject along those bands, especially some of my older beauties or more mature beauties. If you have like really stringy platysmal bands, that can age us or make us look sick or older, and doing a little bit of toxin in those bands will help retract those muscles back and give a beautiful smoothing effect on the neck. You can also do little micro droplets along areas where there's a little bit of laxity, especially if you swallow and your skin kind of crinkles in that area, doing little micro droplets of Botox in that area is really helpful for smoothing out that neck. Again, the placement's very important because there's a recurrent laryngeal nerve that goes around in this area, and you don't want to have problems with swallowing, which we refer to as dysphagia. Again, I've never had that complication with any of my patients, treating thousands and thousands of patients over the last 20 years. But if you're going to the wrong person, or they're reconstituting their Botox or their toxin inappropriately, I can see that happening, so just be careful. Also, there's, besides the platysmal bands and besides the neck laxity and besides tech necklines, you can also do the Nefertiti lift, which is where we do a little bit of Botox along the jawline to kind of help snatch that under. I do it to myself. It's one of my favorite treatments that I do on myself, and I do it all day long on my patients as well too. So those are the areas where you can use neuromodulators in the neck, but you have to be very careful with the amount of units and the placement of the injection points. Next, we can talk about biostimulatory fillers. So now you can use fillers, which aren't really hyaluronic acid fillers. To be honest, I don't even know why we call them biostimulatory fillers, because they should be biostimulatory injectables. But you can use injectables in the neck to help improve that neck skin, and it just upregulates collagen synthesis, and that's usually Sculptra, which is polyallactic acid, or Radiesse, which is calcium hydroxyapatite, and now there's some newer combination biostimulatory fillers that are coming down the pipeline. There's also some that are not FDA approved in the US, but since I'm an American doctor, I'm going to be talking about ones that we use in the US, although there's other ones that are coming down the pipeline soon with great results. For the most part, for the last couple decades, have been using them in the neck, but now with SkinVive, which is not technically called a filler, but it is a hyaluronic acid texture improving injectable, I've been having great results with SkinVive. I've done SkinVive on my neck a couple times now and been really impressed with the results, and you don't have to worry about the formation of nodules that you do sometimes with Sculptra and Radiesse, which could be irreversible. They are reversible, but it takes several rounds of injection of saline to address the nodules should you have those happen from the more traditional biostimulatory fillers. But SkinVive has been amazing. If there is a nodule, you can easily dissolve it with some hyaluronidase, and to date I still haven't seen any nodules with SkinVive, but that's another injectable that's kind of, I think, gaining more popularity and kind of making biostimulatory fillers like Sculptra and Radiesse less commonly used on the neck now than they were used before. And it is off-label to use SkinVive, but gives really amazing results with respect to improving neck skin texture. So almost last but not least, is Ellure. Ellure is the microcoring technology where we use little microcores of skin removal to tighten the skin, shrink wrap the skin. It's almost like taking cheese and turning it into Swiss cheese and then closing the holes. So usually the company recommends, again, it's off-label for the neck, but we're getting great results with Ellure on the neck. I mean, really, I'm fascinated and really astounded by the results that we get from Ellure, even just after one treatment. But the company recommends 3 treatments spaced about 1 to 2 months apart. The downtime on the neck is a lot faster than it is on the face. Usually it's about 1 week for facial downtime with the little red demarcated squares with Ellure treatment on the face. But on the neck, I feel like patients will respond with like half the downtime that they do on the face. So it's a little bit less than a week. And we're getting great results with microcoring using Ellure for neck skin, especially when it comes to laxity and removing laxed excess skin or crepey skin on the neck with Ellure, which is a revolutionary new microcoring technology. You can refer to my Ellure videos if you want to learn more about that as well. And I know a lot of you guys are going to ask about thread lifts. So PDO threads, there's so many different types of thread lifts now, are when we use almost like suture-like material or threads, and we usually have an entry point here. We usually either cross it over the midsection of the neck, depending on if there's a little waddle or turkey neck there, and the threads usually go in pairs of 2, 4, 6 per side, so 12 total, and we'll go ahead and lift up on that neck skin. And people do really, really great with those treatments. The downtime is like 1 to 2 weeks of a little bit of swelling, sometimes bruising, but we want you to kind of minimize your physical activity, which is hard for a lot of us, including myself, to do while the sutures and the threads kind of like settle into place. There's barbs on the sutures and you want them to kind of settle, but it's great because there's not only a mechanical lifting and tightening of the neck, but it's like, it acts as like a slow depot of filler. It also stimulates collagen biosynthesis as well. So you get kind of a increased collagen boost activity, and you get a lifting and mechanical improvement on that neck skin as well. It's not my first line treatment. Usually I use threads for people who have failed other treatments, or they've done enough treatments and they're trying to avoid surgery and they're kind of trying to put off their time. And don't listen to plastic surgeons when they say thread lifts or biostimulatory fillers or lasers or energy-based devices make you non-surgical candidates for a neck lift, because I could speak as a non-surgical cosmetic dermatologist and as a dermatologic surgeon, and I've done plenty of cosmetic and reconstructive procedures and surgeries on people who've had these treatments, and it has not been a problem. There's a lot of fear mongering and marketing tactics out there, so I just wanted to keep it real with you guys, especially as a woman myself. Not only do I do these treatments on my patients, but I get them done myself too, so I can talk to you straight as a friend. So I think it's really important to just know when and where the time and place is right for threads. Again, it's not my first line treatment. Usually I'll do a Thermage first, or we'll do some laser resurfacing, maybe some biostimulatory treatments. And if the results aren't still not what the patient wants as their goal, then we can think about threads. And the only caveat with thread lifts is I wish they last longer. They typically only last about a year or so, maybe even less than that. But I feel that, the company sometimes overpromises a longer lasting result when anecdotally it's usually about a year or sometimes even less. Okay, you guys, so with Thanksgiving next week, Thanksgiving is a time for thankfulness and gratitude, and let's just be thankful that we have so many in office and at home procedures and treatments that we could do to keep the neck skin looking great, so that the only turkey neck that you have encountering in your life is on the dinner table. So with that, I'm gonna say thank you so much. Be sure to like and subscribe and share this video with anyone who wants non-sponsored content and would appreciate learning a little bit more about preventing turkey necks for you and your loved ones. And I wish you guys all a very happy Thanksgiving. I'll see you next week.